Ear tube insertion in children is the most common procedure performed on children in the United States. A lot of people are unsure as to when a child needs ear tubes, and the American Academy of Otolaryngology will tell us that 3 infections in 6 months or 4 infections in 1 year is a reason to put ear tubes in children. I know a lot of people are hesitant to put tubes into children. They don't want their child to have surgery, and I'm all for that also. But when you look at these little children that go through 4 to 6 infections in 6 months, 7 months, that aren't sleeping, they're not eating, they're uncomfortable, we put those tubes in their ears and they're like a different child. I had a patient just today, the patient's mother tell me that this is a different child than it was 3 weeks ago. She's sleeping through the night, she's eating, she's happier. And it's very rewarding as an ENT physician to do such a simple procedure that can help improve someone's quality of life. Insertion of ear tubes is a pretty easy procedure. It does need to be done under anesthetic, as the child does need to be totally still when we do the procedure. But it's usually, we give the child a little bit of a mask or anesthetic through a mask. They fall asleep. We take a microscope and using tiny instruments, insert the tubes in the ears. If there's fluid, we remove the fluid. The child wakes up within minutes and is home an hour later. By the end of the day, you wouldn't even really know the child had had the procedure performed. The average lifespan of an ear tube in a child is about 18 months, which means some people will extrude them or push them out of their ears in a year. Some take 3 years, but the average is about 1.5 years. And 80% of children that have it done one time should never need it again. I typically see my ear tube patients every 6 months to ensure that those tubes are coming out on time. And what happens is as the eardrum heals from the incision where you put the tube in the eardrum, it pushes the tube out. So generally the tube will fall off the eardrum and then work its way out of the ear canal and then fall out of the ear canal. Most people don't see it because they're very, very tiny tubes, about 2 millimeters. So most patients will come back in and I'll say, oh, their tube's gone, and the parent had never seen it. So it's nothing that they need to worry about. They don't need to look for anything. It just requires periodic follow-up to ensure the tube is coming out on time.